Annie Gasparini, and welcome to this segment of Penn Voice. I'm joined today by my friend Lisa Tealer, who is now the interim executive director of the Bay Area Community Health Advisory Council. Lisa, that's a mouthful.
It is. I'm sorry.
It's okay. You and I go way back to your Genentech days, but now you're the interim executive director of the Bay Area Community Health Advisory Council. We'll call it BACHAC for short.
Yes.
So tell us a little bit about the Health Advisory Council and what your role is.
Sure. It's a 24-year grassroots organization really dedicated to eliminating health disparities in diverse communities and across generations. So we kind of do that through education, healthcare education, through advocacy, and really encouraging people to be accountable for their own health.
Right.
I've been involved with the organization 20 plus years, first as a volunteer and sponsor of their programs. And then as I retired, I was approached to do some more volunteer work. And then the volunteer work turned into, can you lead the organization? And I didn't hesitate because it's an awesome organization that's really very inclusive.
Right.
It's very dedicated to making sure people get information about health and advocating for people so that they can have access to information.
Well, knowing who you are, they couldn't have a better person in this leadership role.
Thank you.
So just give us a couple of examples of
Sure.
the kinds of advice or health access that you provide
Sure.
to people.
We partner with healthcare organizations, so for example, Mills Hospital, to provide free mammograms for women who don't have insurance.
Mm-hmm.
We have an annual men's health symposium where men can get prostate exams, healthy heart screenings. Mm-hmm. We have educational workshops on Alzheimer's, dementia. We have an initiative around flavored tobacco because, as you may know, that our young people are being targeted to engage in tobacco use.
Right.
So we do both programming and advocacy. We do presentations to the Board of Supervisors and city councils to talk about some of the healthcare disparities and how we're trying to address that and partner with the county and other organizations.
Right. We have guests on this program all the time from the county behavioral health department. And they always talk about the work that you do and the partnerships that they have with you, because you work really in tandem with each other. And you'd mentioned in the beginning identifying health gaps or information gaps. How do you determine that? Do you take the county's data and then say, okay, these are the 3 things that we're going to focus on? How do you determine what you're going to actually...
Definitely. We definitely base it on data. So we look at the community health assessment that the county puts together. We also talk to the people in the community about what they're seeing and experiencing, and community leaders about what they're seeing around healthcare disparities, and we kind of pull all that information together and base our programming on that.
And then how do you get funded?
Through grants and donors, or people, individuals, as well as organizations, the county, corporations.
So if somebody sees this program and says, you know what, I want to be a part of that, I guess the easy answer would be that they would jump on your website, they could make a donation from there, or they could figure out how to get involved.
Sure.
I'm sure you need a lot of ambassadors out there.
Oh, absolutely. I mean, they can go to our website. We have a donation button. They can call. They can email. We have a pretty solid, about 40 to 50 members that are volunteers, and we meet with them every month to talk about the progress of what we're doing, any issues that are coming up, any events or programs that are coming up, and then a lot of those members are also some of our donors as well.
And can people just go to your website to receive written resources as well? So if they're trying to say, where can I go for affordable health insurance, whether it's something that you give people direct access to or at least a resource to go look at?
We have a lot of information on various health conditions, cardiovascular disease, cancer, et cetera, and links to other places where people can get information. Or they can also call us and say, hey, I'm looking for whatever it is.
Right.
And we'll try to link them up with one of our organizations or one of our healthcare organizations.
Right. So it sort of sounds like this two-way street. You're doing a lot of outreach to try and reach different community organizations, whether it be a senior community or a mom's group or a park and rec group. You're always trying to get out there and talk to people about what it is you do and some of the subject matter. But then people can always find you as well and get information from you. So what are some of the upcoming programs that you have going on? And then what are kind of your annual things that you do every year and people can look forward to?
Sure. Well, every year we do the Men's Health Symposium, which is typically in September, and that's Men's Health Awareness Month. And then in May, we do an event called Soul Stroll for Health, which is a really fun physical activity, 1-3-5-mile walk or run. We have resource tables. You can get massages. You can get your blood pressure checked. The county has the HIV STD van out there. And it's a lot of fun. It's very family friendly. We usually have a celebrity be our honorary chair, and they kind of inspire people and get people going. We do some warm-up exercises, and then people are sent on their way, and they get little medals, they get T-shirts, and it's really fun. And we're trying to help encourage people to be physically active and to know what the resources are. We have the county out there, the Alzheimer's Association, you name it. There's a plethora of nonprofit organizations and other civic organizations that are focusing on health.
And I know one of the big focuses now is mental health. And so I know that's another really big focus of what you're trying to do with your organization and getting people connected to the right help and the right resources. Can you speak to anything about that? I mean, what do you see in the future that it will be coming up with regard to mental health?
Well, first of all, I think the stigma is slowly being lifted around mental health, and people are getting a lot more comfortable talking about mental health because it's part of your overall health. And so, teenage suicide prevention, and then as our aging population, the whole age-related dementia, being a caregiver, what are the stages, how do you prepare yourself as a person either being afflicted by that or your family or your community? So we're going to be doing a lot more programming around that. Like I said, we're working with the Alzheimer's Association and AARP around sort of a telephone series, around the legal aspects. The definitions, where there are resources. And then also trying to, through our flavored tobacco initiative around our young folks being exposed to that, it also impacts them not only physically, but mentally as well.
We're seeing a lot more of that conversation happening. I love the fact that you're actually just having those conversations. The resources are amazing. We need to have resources. We need people to know where they can turn for information resources. But I think even just having conversations about mental health, about flavored tobacco, some of these highly stigmatized issues, we do need to talk about them because it affects all of our lives, personally or the person next to us. And when any aspect of the community is unhealthy, it impacts all of us, either directly or indirectly. And so it's important that we are, like you said, first starting with that conversation and creating a comfortable environment for people to have that conversation, I think is really critical. And I think that's where BACHAC plays a major role, is how do we get folks who really need to hear this information, how do we get them at their church or at like a mom's group or a Bible study. PTA, at their PTA meeting.
Meeting people where they are, I think is really critical because they're already in a comfortable environment. And then that way you can sit down and have those, sensitive types of conversations and get that information out to people.
Well, Lisa, thank you so very much for coming. We've got about just 30 seconds left. I want to make sure that you have the last voice and making sure that we tell the people about your organization or the things that you're working on. What do you want to leave us with?
Well, I just want people to know about this organization, to go to our website, www.bachac.org, or you can just type in our name and you can see what we're doing, the activities doing. We have a monthly meeting, all welcome, second Monday of every month, and it's on our calendar, and people can come in and learn more about the organization firsthand.
Well, I'm so excited that you're in the leadership role.
Thank you.
You and I go way back, and it's a fun thing. And I know that they're real serious topics, but you're going to bring some light to all of it with a little bit of your humor and yet for serious topics. So
thank you, Danny, for the opportunity.
Yeah, the way you approach things. So we'll see all of you next time, and please check out the Bay Area Community Health Advisory Council website. It's really important we all are taking care of ourselves and our community. We'll see you next time on Penn Voice.